Hey everybody, it's Matt Shu from Upright Health, and today I've got a big yellow softball and a question, a follow-up question. Actually, this is the first time in Upright Health history that I've done a follow-up question. And I'm doing it because I think this is a very important question. So Wolverine 31088 a little while ago asked me about hip impingement, and I made a video for him that talked about femoral acetabular impingement and why I think it's a pretty shaky thing. And he took some time to do some research, look at some of the studies that I had alluded to and that I wrote about in the blog post on my website at uprighthealth.com/blog. And he said he thinks that I'm probably right about this whole thing. Cool, I'm glad you agree, because that's step one of helping you get your hips working again. Now, step two is overcoming the skepticism. And so his question is, in your opinion, can someone with a symptomatic femoral acetabular impingement with a hip labral tear heal completely without surgery and only with PT? Follow-up question, is the deep back squat safe for someone with this situation? He mentions a specific orthopedic hip test and that he has limited hip internal rotation. He also says, according to Eric Cressy, who's a super intelligent, big-time strength and conditioning coach over on the East Coast. According to Eric Cressy, it's not. And he asked me some other stuff. I'm not going to cover the other stuff, but let's go with these things. So, in my opinion, can someone with symptomatic FEI and a hip labral tear heal completely without surgery and physical therapy? In my opinion, yeah, pretty much. But I don't think it happens quickly, and I don't think you should be trying to jump into back squats right away. So when you are symptomatic, when you have this situation, you're thinking, well, you're still thinking, I have FAI and this labral tear. Even though you already know that labral tears can, whatever, labral tears in an MRI mean 0. And FAI in an MRI also means 0 in terms of whether or not you'll have symptoms. What you do know is that you have this movement problem. So think about it as a movement problem that you need to improve on. Don't think of it as a disease, because if you think of it as a disease or a disability, you're going to keep thinking you're never going to make it better. So, you have a mobility movement problem. You need to figure out what is restricting your range of motion. I'm assuming, since you've noticed that your internal rotation sucks, that you've already been doing some things to your outer hip to try to improve internal rotation. Right? So the normal line of thought is, if I work on my external rotators, I will be able to internally rotate better. That's a very good line of thought if everything we're doing is from anatomical position. But we don't do everything from anatomical position, and the orthopedic test that you referred to is not done in anatomical position. It's done supine and pulling over. If anyone actually wants to look it up, it's FADIR test, Fader test. And yeah, it will help you determine whether or not that specific motion hurts you. But what does it mean? It doesn't mean jack. It means you can't do that motion. It doesn't mean anything about FAI, because how are you going to now confirm FAI with an MRI? With that MRI, that doesn't mean anything. So what are you confirming? You're confirming nothing. You have a bunch of tests that basically all say nothing, but put together suddenly you think they say something. They don't say anything. That Fader test, that does say that you can't do that motion without pain. That doesn't tell you that it's the bone's fault. It tells you that you just can't do it. So you need to identify what the problems are in your body that are stopping it. If you've already been doing the external rotators, that's great. That was a good start. But like I said, we don't do everything from anatomical position. So what we're going to do is we're going to use a ball, and we're going to hit some muscles along the inner thigh. It can actually limit your internal rotation, even though they are not known as internal rotators. Why does this happen? In that first video, I said your adductors get a little bit too over-involved in your motions, and that's pretty much what's going on. So what we're going to do, and you're going to feel this, unless you're really weird, but pretty much anybody I've ever seen who had hip impingement symptoms while they were trying to train could feel this. You take this ball, you sit on a firm chair or a bench, you take this ball, put it right here. Okay, you stick it right where the sun don't shine, almost, a little bit out to the side there. You can do that on your own time. You're going to stick that right along the inner thigh on the posterior aspect. So you're running into the posterior aspect of your adductors. You're hitting adductor magnus a lot here. Adductor magnus is a hip extensor, and it gets used a lot for helping you do things like squatting and other hip extension motions. Deadlifts, for example, would also involve your adductor magnus. Here's the thing. Adductor magnus becomes this hard, petrified wood piece of crap that won't lengthen, soften, and then do its work. When you try to do things like flex your hip and then internally rotate, you start running into problems, because the adductor magnus doesn't let go, the femur gets stuck, and you go, and it just feels like you hit a hard stop. You may even actually feel it get tight in there, okay? That should tell you something. You need to get that thing, that whole group of stuff, to let go, all right? So this is one of the things that you can do to start working that hip. You can work the hamstrings as well, but definitely try to work that adductor magnus all along that line to help it relax, okay? That, ooh, yes, right? That helps loosen up the hip joint so that you can actually move it better. I mean, it's not going to be a huge contrast on me because I've already done this for years, but it took me years to actually work my hips back into better shape. Was squatting good for me right when I was in my worst situation? No. Eric Cressy and other strength and conditioning coaches are absolutely correct about that. If you're not able to squat properly, if you get to here and then your back rounds, right? If you're going like, oh, and then doing this, that's horrible, and you shouldn't be doing it. But if you can develop the hip mobility to get down, right? If you can get down here while still maintaining proper position, it's a good motion. It's just right now, you can't do that motion, so you shouldn't be doing your squat, right? Once you can start prying those hips apart, once you are able to get down low and keep your spine in a good position, then you should be squatting, and then you can squat more. You can do sumo squat stretches and get way out there, and gradually try to get more depth on it without curving your back like that. You just keep loosening up that crack. I know it feels horrible because I felt it, but if you keep at it, it does loosen up. There's a bunch of adductor stretches you can do out there. I would be researching all the adductor stretches you can find and see what you can get to start opening that up. Start learning to even activate those muscles when they're in a lengthened position so that you develop a bigger range of motion with your hip joint. It is not quick, Wolverine. I hate to tell you, but it's not quick. But I do think it is possible to train yourself out of it. I think the reason most of the time, the reason you hear like from guys like Eric Cressy and some other coaches, they're great. They are smart guys. They're working in an environment where they're trying to push athletes to just get stronger, better, faster, as quickly as possible, and within generally, shortened time frame, like 3 months, off season, 2 months, whatever it is. They're working within certain limitations, and while they try to get in some corrective work, there are times where you run into things that take forever, right? Like this. It takes time to really work out the improper joint mechanics and reprogram your brain and nervous system to move things correctly and without pain. In that, if you're trying to do that in a compressed 2 or 3 month time period while still trying to help somebody front squat another 30 extra pounds and run their 400 and whatever, and cut their 400 time by 2 seconds or whatever the hell they're trying to do, in that kind of environment, it's really, 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 really hard to do, and it's probably not smart to do if you have FAI, in my opinion. But it's about priorities, right? If you're training to try to make your $3 million a year contract, do what you got to do. But if you're just a regular schmo and you have a lot of hip problems, then why don't you just take some time, back things off appropriately, improve your hip mobility, and make yourself awesome again. Hope that helps. Hope that helps a bunch of you. And I hope you remember that pain sucks. Life shouldn't.